everyone, very good afternoon to all. Welcome back to my channel. Today I am going to discuss about the cranial nerves. So this is the topic is related in the subject of the anatomy for the BS nursing first year, first sem who are going to write the examinations in the month of June 5th and 7th. So this is the third uh, challenge for the BS nursing first years. Already I have given 21 days challenge for the students. We can complete the syllabus within 21 days to get a good score in your examination. So let me see the one by one. So cranial nerves. So how many cranial nerves will be there? 12 cranial nerves will be there. So these are all the cranial nerves: olfactory, optic, oculomotor, trochlear, trigeminal, abducens, facial, vestibulocochlear, glossopharyngeal, vagus, and accessory hypoglossal. So these are the 12 cranial nerves will be there. Okay, so let me see the one by these are the very important questions for you people in the especially in the unit of the nervous system. That is the 10th unit. Let me see the introduction. The 12 pairs of cranial nerves arise from the brain inside the cranial cavity and pass through the various foramen in the bones of the cranium. So this is you have tried at least if you know the introduction easily we can elaborate the little bit content at least from starting one line to three or four lines. If you write three four lines, definitely you will get the 1 mark. Okay, so due to the 1 mark also sometimes we can pass also. Okay, so let me see the one by cranial nerves. So the 12 pairs of cranial nerves arise from the brain inside the cavity. So it will erase from the brain inside the cranial cavity and pass through the various foramen in the bones of the cranium. Okay, divides into three functions. Okay, the mainly cranial nerves will be divided into three portions like a sensory nerves, motor nerves, and mixed nerves. How many functions will be carried out by the cranial nerves? Mainly three divisions will be there. So those are the sensory. First one is sensory, second one is the motor, third one is the mixed nerves. Okay. Okay, so the cranial nerves, there are 12 pairs of cranial nerves that supply structures in the head, neck, thorax, and abdomen. So it's mainly the cranial nerves supply structures. It will supply the structures where it is located in the head, neck, thorax, and abdomen. A cranial nerve can be made up of a mixture of functions which are called modalities or may be made up of a single modality. A modality is a sensory, motor, special sensory, etc. and all. Okay. So next coming to the cranial nerves, 12 pairs of cranial nerves are associated with the brain. So it's having the association with the brain. The first two pairs attached to the brain and the rest are associated with the brain stem. Okay, so that you have to keep it in mind. First 12 pairs will be there. First two pairs. The first two pairs attached to the forebrain. Fore means front portion of the brain. And the rest are associated with the brain stem. Okay, this is the brain stem. Other than the vagus nerves, which extends to the abdomen, cranial nerves serves only head neck structure. Okay. So let me see the one by one. So these are the 12 pairs of cranial nerves. Okay, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. Up to hypoglossal nerve. First one is the olfactory nerve. The main component of the olfactory nerve is the sensory. It's the main function of this olfactory nerve. The main function is the smell. We can easily smell it with the help of the olfactory nerve. It may be origin olfactory receptor nerve cells opening into the skull. Openings in the cibriform plate of ethmoid bone. So this is the structure of the olfactory nerve. Next coming to the optic nerve. Second one is the first one is the olfactory. The main function of the olfactory nerve is the smell. Second one is the optic nerve. The main function is the vision. Component sensory function vision origin where it is located back of the eyeball opening into the skull optic canal. Next, third one is the oculomotor nerve. The main function is the raises upper eyelid, turns eyeball upward, downward, and medially. Constricts pupil, accommodates the eye, onto the surface of the midbrain, and the opening to the skull is a superior orbital fissure. If we met any accident, the nerve may be damaged. So if we lost the this nerve supply, so we may not constrict the pupil, we may not accommodate the eye, because that is the reason the main functions of the oculomotor nerve is so these are the main functions. Okay, so this is structure of the location of the oculomotor nerve in the brain. Next one is the trochlear nerve, component motor function, assisting in turning eyeball downward laterally, posterior surface of the midbrain, superior orbital fissure. Next one is the trigeminal nerve. Trigeminal nerve, okay, ophthalmic nerve, maxillary nerve, mandibular nerve. So these are all the main three functions carried out by the trigeminal nerve. Okay, ophthalmic, maxillary, mandibular zone, trigeminal nerve. Next one is the ophthalmic nerve, sensory. The main functions of the this ophthalmic nerve: cornea, skin of forehead, scalp, eyelids and nose, mucous membranes of the paranasal sinuses and nasal cavity. So these are main where it is located, how it will opening into the skull, everything. Next coming to the this is structure of the or location of the ophthalmic nerve. Ophthalmic is mainly related to eye only. Frontal, nasal, maxillary, lacrimal. This is the location. Next coming to the maxillary. Functions of the maxillary nerve. Location of the maxillary nerve. Next coming to the mandibular nerve. Mandible, another name is the jaw. Muscles of the mastication, mylohyoid, anterior belly of gastric, tensor velli palatine, tensor tympani. Mandibular nerve. Okay, so the skin of cheek, skin over mandible, side of head, teeth of lower jaw, and TMJ. Mucous membrane of mouth, anterior part of the tongue. Okay, so the location, anterior aspects of the pons, opening to the skull, foramen, rotundum. Abducent or abducent nerve. Lateral rectus muscle turns eyeball laterally. The main function of this nerve. Next, opening to the skull, superior orbital fissure. How it will be open. Abducent nerve. This is a location of structure. Next, coming to facial nerve. This is seventh one. Muscles of the face and scalp. Stapedius muscle, posterior belly of gastric, stylohyoid muscles. The main functions of this nerve is the taste from anterior 2 by 3rd of tongue from the floor of the mouth and palate. Next coming to vestibulocochlear nerve, eighth nerve. Vestibular, okay, okay, saculae, semicircular canals, position of the head, cochlear, origin of the cottae, hearing. Next, ninth one is glossopharyngeal nerve. This is the mixed one nerve, motor and sensory. Okay, stylopharyngeus muscle assists swallowing. The main function of the sensory organ is the ear. Okay, taste from posterior 1 by 3rd of the tongue and pharynx, carotitis, sinuses, and carotid body. Okay, sacromotor. Next, ninth, glossopharyngeal nerve. 10th, vagus nerve. So this is the vagus nerve location. Accessory nerve, 11th one. Last one is the hypoglossal nerve. Muscles of tongue except palatoglossus controlling its shape and movement. So this is the last one, the main function of the hypoglossal nerve. Okay, where it is located. So this is the way. Okay, so thank you all for watching my channel. So till now I have shown the importance and functions of the cranial nerves. 12 cranial nerves will be there, how it will work, where it is located, how it will open into the skull, everything I have shown. So thank you all once again. Okay, happy day, and don't waste your time. Only time is very limited, so try to do the hard work, get your success in good way. Thank you. Bye bye. See you next video.